This is Dr. Clyde. Some friends of mine and I are posting content at HealthyWell.Fit to set the gold health standard on information to pragmatically apply to your everyday life based on what the research says. AI is an amazing tool for deep diving, mining the research literature orders of magnitude faster than you can do digitally on your own, which was already orders of magnitude faster than hand searching the literature in a library, which is how I started out doing research 30 years ago. So now we're able to discover in short order what has been published, what the data says in papers going back decades, and in short order compare what quality individuals and organizations like the World Health Organization and the National Academy of Medicine have put together from their search in the scientific literature, and can use AI to systematically compare what top influencers are saying for a comprehensive comparison across the board from the original research to the summaries of it by quality organizations. And in sports nutrition, that would include the International Olympic Committee, American College of Sports Medicine, to what academic experts, all the way to what influencers are saying, to put all of that into context in a comparative way. There is nothing more powerful than such a comparison. It is literally where the world stands in terms of its actual knowledge base. And yet, that's not trickling out yet. AI is more being used to amplify the opinions that already existed before. Instead of doing a deep dive to bring us together, it's accelerating the expansion away from each other in terms of how we should live our lives, like how much protein we should eat. Should we focus on VO2 max or the number of steps to maximize health span? The evidence in the literature is clear that things are not inherently better than other approaches, but act on our physiology and psychology differently, and those actions and their underlying mechanisms are clear, but it's not getting out there. We can do better than that. So the process that we are doing here at HealthyWell.Fit to create this new gold health standard is to look at these organizations and academic experts and influencers and do a comprehensive comparison of all of them. This doesn't just serve the global community to improve wellness for all of us directly, but it also provides a resource for influencers, academic experts, and ultimately organizations that they can either use directly through this effort or model it, copy it for their own deep dive search, so that we stop arguing over differences because we're looking at the data through different lenses and realize that we're actually saying different things about the same common core of facts that are generally true for all of us, from which our individual truths emerge. In academia, this is ultimately thought of as a scientific method to have systematic sequence of queries based on research. But once you have so much research that's already been done for decades and even centuries, and the thought process for millennia, of course, to harvest from, and AI now lets us do that in a much more powerful way. But academics have been thinking that way since back to the pre-Socratics and even before that. So I've been honored to be a part of that process at Stanford since I arrived there in 1996, got my PhD in chemistry in 2002 in the summer, and started teaching just a month or two later nutrition and exercise theory with Christopher Gardner, Dr. Dement, who started the Sleep Center, and that evolved over time into the Stanford Living Education Program, or SLED, which has really been the teaching honor of my life. And in parallel with that, equally grateful to have been doing, since 2002 as well, research with Roger Cook in the Department of Biochemistry, Biophysics at the University of California, San Francisco, on the topic of metabolism, which is really the convergence of nutrition, movement, sleep, and stress, the autonomic nervous system, fight, flight versus rest, digest, which is a doorway into things as superficial, you might think, as a jump scare from a cat where your heart rate goes up, the fight or flight, to deeper concepts such as purpose, meaning, and connection, all of which ultimately tap into our metabolism, and that feeds into our health, and then with added depth, our wellness, and with an added intensity, our fitness. So these are the three concepts that we are going to bring together, topic by topic, for the global community, for the academic community, for those who are doing research in a different topic and they want to find out, well, what is the reality on this other topic? I do research on protein, but what about steps per day? There's constantly new work coming out. And so if you automate the search, it is the equivalent of a systematic review, not quite a meta-analysis because you're not repeatedly redoing the statistics on raw data, so that we are updated on where the facts stand. So to the extent that we still believe in truth, we still have to believe in facts. And facts have to be that for everyone, otherwise they're not facts and truth. So it's that factual truth, the onion ring layers down to that level, that we are driving after to provide you.